as we start to treat and the patient will start to feel better, their labs can sometimes look worse.
Yes.
So I also don't like to check on it too soon because I want to give that window in there. And it's not a bad thing, it's a good thing usually.
Yes.
The labs look worse because the immune system is finally coming online and helping. Because a lot of these tests that we're doing are looking indirectly for the infection. We're looking at the immune system. If the immune system was tired and not keeping up, looks more negative. So as we treat, it might look more positive, but that means your antibodies are now joining the fight. This is a good thing. It's not actually worse. It's actually better, but it's alarming.
Hi, welcome to the MAPS webinar series, Healing Tomorrow's Future. We are thrilled to be bringing you this series packed with valuable information and education within our community. My name is Honey Renisella, and I'm the Executive Director of MAPS, the Medical Academy of Pediatrics and Special Needs. Within these webinars, we're able to empower clinicians on the knowledge and tools to support patients facing a variety of health challenges. For more information on MAPS or to register for a conference, please visit us at www.medmaps.org. That's www.medmaps.org. Thanks for joining us on this journey towards a brighter, healthier future.
Welcome back to the MAPS podcast. We're so lucky to have Dr. Casey Kelly joining us today. She gave a wonderful lecture on the endothelium and how that impacts chronic health at our conference yesterday. And so, Dr. Casey, will you please tell us a little bit more about yourself?
Sure, yeah. I have my own practice in Chicago. I got really interested in integrative care with my own health journey, but it's really all I've ever done. I jumped right into integrative care right after residency. I knew I wanted to get into a field that was curious and ask why people were sick and actually try to get to the root cause of what was going on. I got really frustrated with all the med and then a med for the side effect and then a med for that side effect. It was just, it was too much. And so I went on a different path and through that journey found chronic tick-borne infections, mast cell dysfunction, mold toxicity. It just, you just find all of these reasons why people are chronically ill.
Yeah.
And it's been a really, really cool health journey and professional journey. And here I am.
Well, we're so happy that you're here. And so you spoke again on the endothelium, and I'm so curious as to what inspired you to start looking at endothelial health. Was there anything that you were seeing in your practice or in your career that kind of changed the way that you looked at things?
Yes, absolutely. It was COVID. Practice shifted. People started to respond differently to treatments. We do a lot of IV therapies in our office that require heparin, and I needed more heparin. And when I was drawing blood out, it was sticky in a patient that hadn't previously had any history of hypercoagulability. What is happening here? Why are we having to ratchet all of this up for the population? And then I kept seeing Lyme and other things awakened, if you will, by the infection, and all of this just, inflammation just blooming with it. And it just all started to trickle back. And what is happening here? Why is this like this? And COVID, we know, is a potent disruptor of the endothelium in hypercoagulable state and creates that vascular changes. And so then I started digging deeper and how is this related to everything else? And it's really interesting when you start to pull that thread. How these things really these chronic infections can really aggravate the endothelial cells and how that creates systemic infection, or inflammation, excuse me. Yeah.
So maybe we'll back up a little bit. Can you just explain what the endothelium is for our listeners?
Yeah, absolutely. It's the inner lining of the blood vessels. So the endothelials, the inner lining of our blood vessels, which then have muscles and other things around them, right? But it's that inner layer. And that's the protective coating of our blood vessels. And it's meant to be there to help keep everything firm and strong and not inflamed and flowing properly and all of that. And inside of it is this fluffy, I call it a seaweed layer, called the glycocalyx, which helps, again, keep that extra layer protected in that and in our blood vessels. And it's really interesting what it can do and how that glycocalyx and how the endothelial layer protects us and how it can keep us healthy, but how it can also play such a big role if it's disrupted in overall systemic inflammation and perpetuates that inflammation if it's not working capillary.
And I loved kind of the visual you were giving yesterday during your presentation of the seaweed movement of the glycocalyx. And, you know, it sounds like the endothelium and the glycocalyx have a very important function. But when would you typically be thinking about endothelial health and about the glycocalyx besides chronic illness, right? Like, because I feel like this is newer that we're starting to think about the endothelium.
We're starting to dive into it more, which is great.
Yes.
And the symptoms of endothelial dysfunction they're pretty broad, you know, and they're pretty true for a lot of our chronic patients. But you'll see things like post-exertional fatigue, just fatigue in general, brain fog, muscle weakness. You can have ear ringing, and it can just these kind of vague symptoms is where it tends to start.
Okay.
You can end up with really hypercoagulable states, blood clots, claudication, those kind of things too, atherosclerosis. It can lead to all of that.
Right.
But it starts off more subtle.
Yes. And I'm sure even more subtle in our children rather than in our adults, right?
Yeah.
So what are you seeing in our children that makes you think, oh, I need to look at the endothelium a bit more?
Yeah. It's really, for me, it's fatigue is one of those starting points. And I'm starting to just think about it for everybody.
Yeah.
Because now I know how all of these things affect our endothelium, and it's just a core. That's our blood vessels are our pipes. That's how we get our nutrients. It's how we get our oxygen to all of our cells. And if they're not working and we can't get our nutrients, and we can't get our oxygen to our cells, we're gonna be worn out.
Right.
We're gonna be tired.
Yeah.
And just a little bit, that's very poor stamina. You know, you do a little bit and then it takes 3 days to recover. That could actually be a blood vessel issue and an endothelial issue, not just a mitochondria issue.
And when you were just talking about it in terms of vector-borne disease, right? You know, fatigue is one of the symptoms that we actually see with vector-borne disease. And, you know, do you think it is the infection itself, or do you actually think that it could be because it's impacting our endothelial cells?
The answer is yes. You know, these infections are so complicated and complex and so terrifyingly brilliant.
Yes.
They affect so many different aspects of our body.
Right.
So the active infection itself is going to play a role. The endothelial destruction will perpetuate it and play a role. The mitochondrial dysfunction, the nutrient depletion, all of it,
Yes.
which is why it's so hard to really actively treat these patients and why I think an integrative approach is the only way to do it. Because you have to be able to have someone who can look at the entire system as a whole.
Right.
You can't just give someone antibiotics and be done, right?
No, it's not
If
never
only.
that easy.
If only, right? So we have to be able to juggle all of that. But I don't think we're thinking enough about the blood vessels and the endothelial cell. And it's a place to think about healing and repairing as part of the process.
So we should be thinking about it, but should we also be testing for it? And if so, what would you recommend, you know, a clinician ordering or looking at for these patients?
Well, a lot of the ligands and things you can test are all research-based only, so we don't really have access to that as clinicians. There are, you know, functional mediated dilation testing that you could do in a hospital. That's not really where we are. So one is, you know, a good clinical exam. You could look at capillary refills. You could look at that. I do a lot of sticky blood hypercoagulable markers to help me gauge if there's an issue there. But I actually think, you know, one of the most elegant, cheap, inexpensive ways to test this is a urine microalbumin.
Interesting.
Yeah.
Okay. And so what are you looking for in terms of the values or the results there?
If you see an elevation in the microalbumin, which is the albumin that's, you know, you'll see albumin on a regular UA. This is microalbumin, so even less than that. If you're seeing that, it means that the glycocalyx in the endothelial layer in the kidneys is disrupted. It's allowing now proteins to filter through, which are going to get excreted in the urine. That means that layer is disrupted. And if that layer is disrupted in the kidneys, it's probably disrupted everywhere.
Right.
Yeah. So it's a really nice, inexpensive, cheap, and easy way on kids. Much easier than getting a blood test to look and see just really quickly, is there a big issue that we need to deal with?
And something you can also then track easily as well with treatment. I always tell people, like, we're not treating a piece of paper, we're treating the child, right? But it is sometimes nice as you go through treatment to just see if there are markers showing improvement, especially with things that we can't really see with our eyes, which are our blood vessels, right? And so if you're suspecting this, the child is having symptoms, maybe some of the blood tests or the urine tests are coming back. What are things you're thinking about to strengthen and support the endothelium?
Yeah. It's tricky with kids because a lot of the things are pills and that's hard to get in. So I always start with food.
Right.
And try to get those foods in there that are going to support that glycocalyx and nitric oxide production. So think of the rainbow, but especially things like beets.
I love beets. I know you said you don't like beets.
No, I like beets. I just I can't get kids to eat beets because I think it's a dirty flavor and a lot of kids won't eat beets.
Yes.
If I can get them to eat beets, great. But there are beets powders and things like that. That's an easy sneak to get it into their smoothies and things like that, or make a popsicle with it, those kind of things.
Right. Yeah. So beets are one.
Beets are great. Yeah. All the sulfur heavy foods too, broccoli, cauliflower, kale, those are also really good for the glycocalyx and healing and repairing that. So fruits and veggies, right? All of that stuff. Nuts and seeds and the good stuff, right? All of that. So that's where we start. And a lot of our patients are already doing a lot of that good work. To the best of their abilities, because kids are tricky, right, with their specifics and what they will eat and what they won't. If you're really worried about it, though, there are some supplements out there that are food-based and have seaweed extracts in it that help to repair the glycocalyx that you can open. You can open those capsules. You can put it into the beets powder, the smoothie. It's just food. These are just food-based capsules and supplements, and they're really easy. Kids tend to tolerate them pretty well, and you can hide it in their applesauce.
So you mentioned seaweed as a food to help the glycocalyx, which looks like seaweed.
Exactly.
And I find it so interesting that sometimes nature gives us clues on what it can help to support, right? And so, you think about like walnuts, for instance, they look like a brain. But they are very good for brain health, right? And so I guess it's similar. I can add seaweed to that list now of this is going to help the glycocalyx and our endothelial cells.
There's very specific seaweeds. There's a brown seaweed and a green seaweed, but it's a very nice metaphor to use because it goes back to it. And, oh my gosh, the things that are going to heal are glycocalyx is seaweed. Yeah. It's wild, but it's really cool. Nature's great.
Some of the parents that might be listening or that are coming into, our practices, they really like to have like concrete information, like how much do I need to feed how many beets do I need to feed my child? And I'm sure it matters how big they are, how severe their symptoms are. But do you have like a general guideline in regards to, the amount or the serving size that they should be?
I don't really. It's more about trying to get it in them.
Yeah.
And it's not even that you need to have it every single day, but you could do, the powders are easy. Those are usually a scoop, and if you can get that in every day, awesome.
Right.
But if you can give them a beet a couple times a week, all the better. Yeah.
Right.
So, but I don't have it specifically set out that way.
Oh, I think that probably makes it less pressure on the parents. Exactly. So that's great. But just incorporating it. I always try to focus on what can we add into the child's diet rather than taking things out. So I love when therapies include adding more in for them. And then what about if you had an adult that had endothelial dysfunction? Is there anything besides diet that you might be looking at or thinking about?
So the same supplements that we use with the seaweed, we can use in adults as well. Also anything that's going to support nitric oxide. So there are supplements that help with that too, that have arginine and citrulline in them, to help support that and boost that up. Good old fashioned fish oil is going to be very helpful. Making sure our minerals are replete. All of that's going to be important. It's interesting because the glycocalyx also has hyaluronic acid and glucosamine, which we think about for joints.
Yes.
But it's also in our blood vessels in there. So joint support can help our blood vessels. So even some good joint support supplements can also help our blood vessels. So,
and I was a little surprised on the dosing that you had up there on the PowerPoint for arginine, right? Like I think, we might be underdosing it actually when we're putting it in. And, we use it a lot for endothelial support, as you said, for Bartonella. But I think, after seeing your presentation, I'm like, I might be underdosing that.
Yeah. Yeah. And I think it was 24 grams for an adult per day, which is a pretty high level of it. And we use it for Babesia too, which depletes this as well. Do have to be mindful of lysine balance with the arginine. So there's that play in there too. But yeah, it's possible that we are all underdosing these things, especially in the light of, this post-COVID world and where we are and how our blood vessels, our endothelium are so destructed.
Absolutely.
This, yeah.
Because I've used higher doses, but more for like wounds healing, actually. But I hadn't pushed up to the 24 grams. It was mainly like 14 grams and seeing great results even with that. So that's wonderful. So thank you for sharing that. And, when are you thinking about like even backing it up even further? Like when should a parent be worried about their child maybe having an underlying infection or thinking about vector-borne disease, which I know is your specialty? Because I feel like, we're often told that it's behavioral or a child has, a mental health condition, it's just anxiety. So when would you encourage parents to start digging deeper for vector-borne disease or chronic infections?
I think parents have an inherent spidey sense. And I think they know earlier than they even maybe are willing to admit.
Yeah.
And sometimes it's easy to just say there's something going on and the doc said it's anxiety. Okay, that's what it is. That might be easier. But I think a lot of parents just have that thought already inside that this is something different. It doesn't feel right. It doesn't feel like it's just anxiety. And certainly if you go down that route, the conventional route, or trying to treat everything conventionally and it's not helping, that's when it's a really great time to re-examine.
Absolutely.
What else could be going on in here? What am I missing for my child? And that's, So anytime you have any of those, like that feeling that there's something more, there might be, and you should follow up on that. But that's where the integrative, type of physicians and providers are going to be the people that you really need to seek out to get that second opinion.
And what do you say to parents who say they've never found a tick on their child?
Yeah, most adults haven't either. They're so tiny. The larva and the babies are so small, you're not going to see them. They're the size of a period on a piece of paper, and we don't feel them.
Yes.
So it's really easy to miss a tick.
Yes.
And it doesn't have to be attached to you for 3 days in order to transmit it. We don't know exactly, but it can happen a lot faster than that. And you don't feel it. It could crawl up in your hair. You don't see it. It's really, really easy to miss these. That's why I'll ask about exposure risk. Even golfers, it's like you don't have to be a camper, but do you go outside? Do you have pets? Do your pets ever get ticks? That's another clue that you have been exposed to them as well.
Right.
So I think I didn't see a tick. I never saw a tick.
Yeah.
Most people don't.
I always say in practice, I'm more concerned about the ticks I don't find than the ticks you do find. Because if you found a tick on your child, you likely might have taken it off, gone to the pediatrician, maybe got prophylactic antibiotics or tested it. But I also think it's really important that we now are calling it vector-borne disease, right? Not tick-borne disease. And maybe you can explain a little bit more of why we've transitioned the terminology to vector-borne disease for our kids.
So vector really means any kind of biting insect. And there are several infections, Bartonella, for example, that actually get transmitted much more prevalently know of on other things like lice, for example. So other biting insects transmit a lot of infection. So that we're trying to not limit it just to ticks and just to specific ticks. It's just any kind of biting insect, mosquitoes, etc. That will play a role in developing these chronic diseases.
And in your practice, when we hear about ticks, we think a lot about Lyme disease and we think about that bullseye rash. But do you see Lyme disease a lot, or do you see some of the other co-infections more so in our children, especially the ones that might have other neurodevelopmental disorders like autism or PANS and PANDAS?
Yeah. I think the big three are Lyme, Bart, and Babesia. Those are the big three that we see, and they're hard to treat. These are not simple, take 2 weeks of antibiotics and you're done type of thing. These are deeply embedded, chronic, stealth, wickedly smart infections, and they stay for a while. They're manageable. We can put these into remission. We can treat this. It's just not an easy road. But especially Bart is really bad with anger outbursts. I call it hulking out. That little kid who just hulks out, and then they don't even remember why or what happened. Babesia is a little more like the anxiety, deja vu, depersonalization type of symptoms. Lyme can kind of cover the gambit, so we always look for that too, and the different things that happen there. But we see a lot of it, but we're looking for it, right? And these are major culprits for those symptoms for these kids.
I always say these are stubborn germs, that it takes a long time. They love their life in their child's body and they want to stay there. But how do you set expectations for parents, like in terms of length of treatment?
Yeah, it's a marathon. It's not a sprint. This is not an easy road. It's going to be bumpy. There's going to be ups and downs. and then feel worse before you feel better. And we do have to set those expectations, right? Because they're not easy. And the terrain matters, and the child's environment matter, and their genetics matter. And it's different. I have families that have, 6 kids, and they're all presenting differently.
Yeah.
Right. And so God love the mom who can keep it all straight in there. But, everyone is so uniquely affected by these infections. It makes it tricky.
Yes.
And to balance it all. But it's from the get-go. It's like, this is going to take a while. 6 months, 12 months, 2 years.
Yeah.
It's going to be a bit. You're going to feel better along the way. So it's not 2 years of continued misery.
Yes.
And then all of a sudden you feel better. Right.
Yeah.
But it's that bumpy road out there. And I want to know when you plateau. And I want to know if it downslides and stays downslid. Those are when we need to start to change and adjust and reevaluate what our next steps are.
Yeah, I think that's so helpful to kind of set those expectations for parents, and also to know, like, they are going to feel better. It's not always going to be like this, for that period of time. But when do you look at like retesting, to see when these infections clear?
It's a good question. We'll test, and we check different lab markers and things, microalbumin or other things along the way. Every 3 to 6 months or so, we're kind of checking in on stuff. What can happen too sometimes is, as we start to treat and the patient will start to feel better, their labs can sometimes look worse.
Yes.
So I also don't like to check on it too soon, because I want to give that window in there. And it's not a bad thing. It's a good thing usually. Yeah. The labs look worse because the immune system is finally coming online and helping. Because a lot of these tests that we're doing are looking indirectly for the infection. We're looking at the immune system. If the immune system was tired and not keeping up, looks more negative. Yeah. So as we treat, it might look more positive. But that means your antibodies are now joining the fight. This is a good thing. It's not actually worse. It's actually better. But it's alarming to patients. Like, we've done all of this. Why are my labs worse, right? So it's all in context, and it's all that big picture, and you have to look at it all, where you are in the treatment, how you're feeling, and in there. But I do like to keep tabs on things overall, just so I get a good arch of where we are and then what different things we need to target.
Absolutely. I agree 100% with that. And what we're seeing is a lot of our kids have immune dysregulation, that they're not mounting the antibodies and the titers that we would anticipate that they should. So that's why, I say it over and over again, is like treating the child and not the piece of paper, right? Because if they're presenting with the history and with the symptoms of, a certain vector-borne disease, perhaps, initiating treatment regardless of what's coming up, because it could be that their body is just not healthy enough, right, to mount that antibody response. And I was curious, since you started to look at the endothelium and address the endothelium and put in dietary support for that, are you seeing quicker improvements in symptoms for your patients with vector-borne disease, or any changes that you're noticing?
I think it still takes forever, so that's hard to judge, because, like 9 months versus 8.5 months, right? But I think people are feeling better quicker. Their stamina is improved. They're getting their nutrients and oxygen to their tissues better. So everything does kind of get enhanced in a good way. Yeah. You start to feel better sooner and kind of judge through that. It's still a long road. Yeah. But and just that little win sometimes too. Like, I can now take a shower without having to take a nap afterwards is a huge victory. Right? So those little wins keep us going and help us move it forward. And
and being able to walk up the stairs without being completely out of breath, or being able to add in a little bit of exercise, and that helping with the mental health. It is huge. Those little wins. And I guess paying attention to those little wins, because they all add up to very big wins. And so I think that's a great point that you make there. So do you have any advice for any parent that might be listening to this episode who might be thinking that their child has vector-borne disease, or are being treated for vector-borne disease, but they're kind of like plateauing, and, how to have that conversation about endothelial health with their provider?
Yeah. Oh my gosh. Well, if they think that their child has vector-borne illness and they haven't gotten in treatment yet, or don't have a provider who's willing to listen to them, I would say seek out a MAPS or an ILADS provider first and foremost. Get out there, get it to someone who's going to listen to you and help you through that journey, and test and see if it's there or not, and then work through it with you. If you're plateauing, it is always a good place to look. Are your blood vessels perpetuating this? And that's why we're stuck and like we're not able to really heal. So we could do microalbumin. You could just talk to your physician, say, hey, I heard about the endothelial cells. I know it sounds crazy. Can I check my kidneys to see if that's, an area? You also you could just start eating these foods. You could start adding these foods right away. You don't even have to wait. You can just kind of assume if my kids got tick-borne infections, they probably have some baseline endothelial dysfunction. Maybe I should add some beets. Yeah. So that's a pretty simple thing that you don't need to talk to anybody. You can just advocate and start to add some extra new fun foods to your kids' diet, see what happens. Yeah.
Wonderful.
Yeah.
Thank you so much for sharing your knowledge with all of us. And so if people want to find you, learn more about you, work with you, how can they find you?
Yeah, we're online, caseintegrativehealth.com. You can find us on Instagram, Facebook. I also have healwithcase.com, which is a website where I've created some online training tools for patients. You can learn about basics right now in our Groundwork for Healing course, and I have a Lyme course that's coming up too, so stay tuned.
Wonderful. Well, thank you so much for joining me.
Thank you.
Thanks so much for joining us today. I'm Honey Renisella, and this is MAPS. As we heal tomorrow's future, we appreciate you joining us on the journey. We'll see you next time.